In patients with hip impingement, accurate arthritis scoring is critical for determining whether hip preservation surgery will be successful. Is scoring with MRI more reliable than scoring with standard radiology? A new study published in the American Journal of Sports Medicine suggests not. Hip impingement involves scraping of the femoral head against the hip socket, which causes pain and structural damage. Arthroscopic hip preservation surgery can provide relief by repairing cartilage tears and reshaping the bones, and it's less drastic than total hip replacement. The outcomes of hip preservation tend to be best for those without arthritis, so the presence and degree of arthritis are generally scored before the surgery. However, intra- and inter-score variability tends to be high, calling into question the reliability of the assessments. The new study investigated whether the greater detail afforded by MRI results in more reliable scores than those achieved with plain radiographs. In the study, 7 experienced hip preservation surgeons reviewed hip radiographs and MRI images for 50 patients. They scored the images in 8 categories and compared the intra- and inter-rater reliability between the radiography and MRI-based scores. Most of the radiograph-derived scores exhibited only fair agreement among raters, including the joint space narrowing, osteophyte, and subchondral sclerosis scores and the tonus grade. The subchondral cyst and Likert osteoarthritis scores exhibited moderate agreement among raters. Similarly, all the MRI-derived scores except one exhibited porta-fair agreement among raters, while the subchondral cyst score exhibited substantial agreement. The intra-rater reliability for the same images was generally better than the inter-rater reliability. However, individual raters didn't score any more reliably with MRI images than with radiographs. Notably, only coronal and sagittal MRI images were used, not the whole scan, and the MRI images were originally obtained to assess labral pathology rather than arthritis. In addition, the radiographs were obtained from a single center that typically sees a high volume of patients without arthritis, which could have biased the patient selection. Furthermore, there was no set criteria for positive arthritic findings. Instead, the clinicians relied on their own definitions informed by experience. Despite these limitations, the results reveal that even highly experienced clinicians score hip arthritis very inconsistently using either radiography or MRI. Thus, MRI is not superior to radiography for pre-hip preservation arthritis grading. The findings also emphasize the need for better scoring protocols to ensure that patients are receiving the right care for their hip impingement.